Welcome to the ANEW Insight Podcast, empowering and inspiring your journey to optimal health. Hosted by Dr. Supatra Tovar, clinical psychologist, registered dietitian, fitness expert, and author of Deprogram Diet Culture. Rethink your relationship with food, heal your mind, and live a diet-free life. I follow my guests' journey to optimal health, providing you with the keys to unlock your own wellness path. Tune in and evolve with us. Welcome back to the ANEW Insight Podcast. We are back for the second half of our interview with neuropsychological assessment and psychology expert and president of the Los Angeles County Psychological Association, Dr. Cris Scaglione. Welcome back, Dr. Cris.
Thank you.
Dr. Cris gave us some really invaluable insight and perspective into her inspiration and work in neuropsychology. We cannot wait to learn more, especially about her work with LACPA. So I am going to start with the obvious elephant in the room of January 2025, Los Angeles. Unless you were living under a rock, we experienced the absolute worst wildfire in all of California history. And that was probably one of the scariest things that we've ever witnessed, ever been through. Talk about your hopes about LACPA in terms of its response to this wildfire and what you want the organization to do for the community that is so in need right now.
Well, you were a huge part of the response. What I'm hoping for is that, as any disaster can be, it's also potentially an opportunity for us to reevaluate how we want to be in the community. LACPA is a really interesting organization. It's a professional home for many of us, but there are times when it has been very active in the community, at least for brief periods of time. What I'm hoping that happens is that we become more nimble and more responsive to community needs. And as much as we initially did, both within our organization and in combination with the San Gabriel Valley Psych Association, this community is going to need assistance for years. This ain't over. The tension, the ongoing stress of just dealing with insurance companies.
Yes.
Not being able to get back to your home, and if you do, it's a toxic wasteland. Not having a home at all. And the rebuilding. We're going to be in a construction zone for 3 years at least. So the community has a lot of needs now that it never did. Many of the communities that were devastated were wealthy and well-resourced. They still need help. Many of the communities were also not so well-resourced, and they're going to have a much probably tougher road of adjustment for years to come. So what I'm hoping is that we can, as an agency, as an organization, become more active in the community, doing real good. Not just saying our hearts and prayers, which we haven't done, but I really dislike it when agencies and organizations do that when they could in fact be doing a lot more. I'm hoping that we can pair with other disaster response agencies like CORE, for instance. I hope that. But one of the difficulties with a professional organization that it really is there for the profession and allows us to get things like legislation passed that's good for practitioners or for the mental health of our communities. And it hasn't been a socially active or social justice oriented professional organization yet. And I'm hoping that we get more of that. We're also getting younger members, and that's where a lot of our activism comes from. They do have more bandwidth for that at the very least. So that's my hope anyway, that we can continue the active community-based participation that was begun as a result of the fires.
Absolutely. And For those of you who don't know, I'm the co-chair of the Disaster Response Committee. So obviously we kicked into high
you did.
gear in January. I don't think we're as prepared as we needed to be at all, but what we were able to do is band together and get a lot of people trained in psychological first aid. That was our first mission. We gathered resources, and we got out into the community and did donation drives. We are continuing to work with wildfire survivors, right now doing some healing equine events, which have been absolutely magical. And one person really, what they said stuck with me, in that she thought, because it's not in the news cycle anymore, nobody's remembering us. Nobody's even really thinking of us. They think that we've moved on, and we haven't.
No.
And so a question I have for you is, how do we make sure that their voices continue to be heard?
Yeah, that's a good question. That happens all the time. Emergencies are not news cycles. They're two entirely separate things. I think that what I would like to see, in fact, sometime I need to meet with you guys about some ongoing specific action that we take at places that are housing people. I have some students that are music therapists that want to go to these places. You've trained up a lot of people doing psychological first aid. But, it's not just about counseling. This is about, food, hygiene products, things that people need that we could also be more involved in as well. I would like to have us broaden our idea of what mental health is about. If somebody needs a sandwich, I'm not going to talk to them about what it means to not have a sandwich. I'm going to get them a sandwich. And I'm hoping that we do more of that.
Absolutely. I think that there's so much more work to be done. And
yes.
I think it's so important that we just don't ever forget about what this entire city went through. Even if you weren't affected, on a visceral level by the fire, everyone in Los Angeles was affected.
Yep.
And I think what was beautiful was to see, I think Los Angeles has a reputation that's undeserved. This is a city full of extremely caring, open-hearted, giving individuals, and the response was amazing for this wildfire, and we just want to see it continue. So
Absolutely.
That's a part of your goals for LACPA. What are your other goals? Name a few goals that you would really love to see realized.
Well, it is our 80th anniversary. This organization started right after World War II. It's been through a lot. It's seen a lot. It has evolved a lot. And I would like to have the theme of celebration continued throughout. It was a little tough to start that in January. Nonetheless, we had lots of things to celebrate, and one of them was the thing you just pointed out. Our cities, our counties' response to the need of our citizens, our fellow citizens, our neighbors, was pretty remarkable. I think I would like to be able to help push that as well. I think that joy is something that I would like for us to feel more, to be actively spreading. This goes back a little bit to what I mentioned earlier, and that one of the reasons I went into neuropsychology was seeing that despite considerable hardship and considerable impairment, when people find that core